My name is Britt Kirwan. I'm Chancellor of the University System of Maryland, and I want to welcome all of you here joining Wallace Lowe and Jay Perman to make a very important announcement. Before I do that, I want to recognize two members of our Board of Regents who are here. Pat Florestano is somewhere in the audience, there on the first row, and Stephen Herskowitz, our brand new student regent from College Park. Today, we are very pleased to announce that the Council on Education for Public Health, the nationally recognized accrediting body for the graduate schools and programs in public health, has approved our application for the accreditation process of a collaborative University of Maryland School of Public Health. This starts the process that will join the accredited University of Maryland School of Public Health at College Park with the accredited Master of Public Health program at the University of Maryland School of Medicine in Baltimore into a single School of Public Health. Once the process is complete, the University of Maryland School of Public Health will, overnight, become one of the nation's leading such schools in terms of the quality of its faculty and students and the volume of its research. This is one of the first visible and significant beneficial consequences of MPower, the intensive effort to unify existing programs and to create new joint programs between the University of Maryland, Baltimore and the University of Maryland, College Park. More such announcements will follow in the coming months as the work of MPower proceeds. The catalyst for the creation of MPower and these exciting developments is, of course, a state treasurer, the longest-serving president of the state senate in the history of a state senate in the history of the United States, who I'm proud to say is a graduate of both the University of Maryland College Park and the University of Maryland Law School in Baltimore. Higher education could not have a better friend and supporter. Ladies and gentlemen, please welcome Senate President Mike Miller.
Thank you. Folks, just very briefly, this is a great first step. No system in the United States works the way we do it currently, where the premier research university, the flagship university, continues to be siloed off from the professional schools. This is a great first step. The next step's got to be engineering and the medicine. It's got to be computer science in the professional schools. It's got to be public policy in the professional schools. We're making progress. We have a long way to go, but it's a great first step, and I congratulate all of the principals for making this happen. This is a wonderful state, but we need to do much better in terms of our vision, our coordination, our regionalization. The Brookings Institute said so just this spring. And again, I'm so very pleased and proud to be a graduate of both institutions, and I thank the leaders of both institutions for coming together, staying together, and working together to make this happen. But it would not have happened, it could not have happened without the vision enunciated by the Chancellor, Dr. Kirwan. Dr. Kirwan has been my friend for 40 years. He will always be my friend. He is a great leader that we brought to this campus many, many years ago as a faculty member, president, went to Ohio, slipped away from us and brought back now. And so some of the visions that he enunciated 15 years ago are now coming to pass. And I, again, congratulate him for his vision and efforts in making it happen. Thank you very much.
Mike, thanks you so much for those very generous comments, and I think we all recognize, and it's just important to say that we wouldn't be here this morning with this event if it wasn't for this man. So, Mike, we just cannot thank you enough. We're joined by another member of the General Assembly, a person that I've known for many years and I have such great respect for. It's Delegate Jim Hubbard from Prince George's County, who's been a member of the General Assembly since 1992. He's a TERP alumnus, a leader in the healthcare arena, and a longtime member of the University School of Public Health Board of Visitors. Would you please recognize him? Jim, we thank you for coming today and for all you have contributed to advancing our state, but especially public health. As I noted just a moment ago, this is just one example of the new collaborations that are moving forward rapidly by the University of Maryland campuses in Baltimore and College Park. Here to comment both on this announcement and to review the progress being made under Empowering the State are two outstanding leaders and my dear friends and colleagues, Presidents Jay Perman from the University of Maryland, Baltimore, who will be followed by President Wallace Lowe from the University of Maryland, College Park. So, Jay, the podium is yours.
Are you going to stand and hold it, Brett?
Where does this go? There you go.
Now we're official.
All right.
Thank you very much, Chancellor Kirwan. Mr. President, thank you so much. Just to briefly review, University of Maryland Empowering the State is a new working relationship between the two universities, University of Maryland College Park, led by my close colleague Wallace Lowe, and the University of Maryland, Baltimore. It's a relationship that demands teamwork and collaboration with joint efforts championed and supported at the highest levels in our academic structure. And we expect these changes to have a profound effect on our productivity, on the economy, and on the very fabric of higher education in our state and beyond. These rapid responses that Wallace and I are going to briefly review are made possible by a steering committee whose members have been appointed by President Lowe and me. Wallace?
Let me begin by echoing what Jay has said. In the past 6 months, we have made probably more progress in terms of bringing together the two great research universities of this state. We have made more progress in 6 months than has been accomplished in years. And this is due to the leadership and the vision of Chancellor Kirwan, of President Miller, with the strong, strong support of the Board of Regents. So let me just give you, I'll pick 3. That's a nice number. 3 examples of the very concrete and significant progress that we've made, and I emphasize in 6 months. Number 1, we have created something called the University of Maryland Ventures that integrates technology commercialization in College Park and in Baltimore. The two of us, our two institutions, generate over $1 billion in external research funding. And our task in the 21st century is not only to be research universities, but also innovation universities that translate the fruits of that research into practical applications, spin-offs, the creation of new jobs, new technology that enhance the economy of this state and this region. Number 2, we have at Shady Grove, in one of the most rapidly growing counties in the state, the universities at Shady Grove, we have come together to plan for a new building that will bring in new programs to Shady Grove that are not available anywhere else. We are going to bring programs from College Park that are not available in College Park, and we're going to bring in health sciences related programs to Shady Grove that will meet the needs of the students in that region, that will serve the 270 biotechnology corridor, and that's just one example. We'll be offering degrees together with Montgomery College in the area of biotechnology. And the third area I would mention is the expansion in our seed funding. We have significantly expanded the seed funding for our scholars and researchers in both campuses to make a real impact. And let me just give you one example, which has already generated that seed funding, significant external research funding. A neurosurgeon in Baltimore, a mechanical engineer in College Park come together and they develop a mini robot that somehow can wind its way to the brain to enable that neurosurgeon to do incisions or cuts or whatever they do to the brain that only a mechanical robot can do far better than the human hand can do. And if that invention were to be patented and marketed, that would be an example of the kind of tech commercialization that will spring forth from our both campuses. Thank you.
And let me add to the accomplishments that Wallace has cited. We should never forget that an important part of the Empowering Initiative is for our students. And for our students, the first scholars, part of the Empowering Initiative from College Park, spent this past summer working in laboratories at the School of Medicine in Baltimore. And I want to recognize Dean Reese for making that as well as some of these other initiatives happen. Number two, systems are now in place to allow a single grant application and its management from both institutions together. And in fact, the marriage that Dr. Lowe just told you about, the neurosurgeon and the scientist from College Park, they have submitted now a major training grant application in neuroimaging. These are two faculty partners coming together as a result of this initiative, and we have the infrastructure to let them do it together easily. Number three, we're making joint appointments to College Park senior level faculty, including Dean Emeritus Bob Gold of the School of Public Health, which is germane to this presentation. They have already been added to the faculty of the University of Maryland, Baltimore in the School of Medicine. More appointments are in the works. Number four, related to getting the faculty to use what we have together, a joint library initiative has resulted in access to resources at the College Park and Baltimore libraries. Thus far, a savings of $80,000 annually. More will be done in this regard, adding to the savings and adding to the ease. And then finally, and again germane to our subject matter today, a new initiative that is facilitated by Empowering, particularly close to my heart, something that has been announced as the Institute for a Healthiest Maryland, which I have the pleasure of co-directing with our State Health Secretary, Dr. Sharfstein, who you'll hear from shortly. And we are, importantly, already partnering, us at UMB, with the University of Maryland School of Public Health, and we're very pleased that the University of Maryland Extension Service and the College of Agriculture at College Park are also going to be partners in the Institute. Thank you.
Jay and Wallace, let me thank you both for the extraordinary leadership you have provided to building the impact of empowering the state, but also for the tremendous leadership you give your two institutions. Jay mentioned, Jay or Wallace, I forget, mentioned Bob Gold, who is here today. I think, where's Bob? Bob is the founding dean of the School of Public Health at College Park, and we all owe him a debt of gratitude because he just did such a phenomenal job into building this into really an exceptional school of public health on a very fast track. So would you please join me in recognizing his efforts? Jay and Wallace, of course, are providing the leadership for this, but we all know that things don't happen if there isn't a team following behind them and making the efforts to create, to realize their vision actually happen. And I want to recognize the two leaders of that team at this time. The first is Ann Wiley, from provost at College Park, and the other is Bruce Jarrell, who is the provost at UMB. We thank you both very much for all of the excellent work you have done to move this forward. Now to give us the specifics about the plans for the Collaborative School of Public Health, I am very pleased to introduce Jane Clark, a longtime friend of mine, a colleague at College Park, who is the new dean of the University of Maryland School of Public Health in College Park, and she's joined by Dr. Jay Magaziner, who's chair of the Department of Epidemiology and Public Health at the University of Maryland School of Medicine in Baltimore. So, Jane, are you first, and then Jay? Yes, and then Jay.
Good morning. A collaborative school of public health is a unique, very unique structure. It's a term used by the accrediting body, which the Chancellor has recognized, the C for the Council on Education and Public Health. It describes a collaborative school as one in which you join multiple institutions to be accredited as a single school that will offer complementary instructional, research, and service programs achieved with a shared mission and goal. Maryland's new Collaborative School of Public Health will be the fourth in the country. First one of these was in 2001, so a relatively new kind of structure. Jay, my new partner.
Thank you. Thank you, Jane, and thank you everyone else who's been involved in this, this journey that we're on. I want to especially thank the dean of my school, Dr. Reese, who has been a tremendous supporter of collaborative activity no matter where it takes us. And I think that's really essential to what we're trying to accomplish in working with the College Park partners in public health. The thing that I want to talk about is how students will benefit from the education and training on both campuses, because they'll have wider access to more opportunities that they may not have had they stayed within their own campus. They'll be able to have access to faculty, expertise both in College Park and in Baltimore. The basic degree requirements won't change, and they'll continue to include the core areas of public health. But what will change is that the collaboration will create new opportunities and bring together the complementary strengths of both campuses.
One of the ways that we will try to bring our collaboration closer is by the use of smart classrooms and smart, that is, everyone in the room is smart, but the rooms will now use technology which will allow us to go up and down the road without actually going up and down the road. So online and blended classes will become more commonplace. We'll encourage students to take courses at both institutions and take advantage of the excellent faculty at both of our campuses. It's likely that faculty will teach on one campus or the other, depending on their expertise and what is being offered. But more importantly for the students, they will be able to share not only the faculty on their own campus, but now the faculty at the other campus.
The collaboration is about maximizing the opportunity by drawing on the complementary strengths, which we've already started to talk about. The already accredited School of Public Health in College Park offers all of the core public health courses and brings special expertise in several areas, including social and behavioral sciences, health education, health promotion, and community-based research. The University of Maryland School of Medicine's Department of Epidemiology and Public Health brings strengths in other areas. We're particularly strong in epidemiology and biostatistics, clinical research, global health, and we have complementary strengths in behavioral and social sciences and population health. The University of Maryland, Baltimore also has a reputation for training students who wish to infuse public health into their respective professions through innovative dual degree programs. I want to emphasize they are dual degrees, so that a student can earn a Master of Public Health degree at the same time that they earn degrees in dentistry, law, medicine, nursing, pharmacy, or social work. The ability to bring these together will allow public health to move beyond the traditional boundaries that public health has often found itself in, and move these into other professions where change is really needed if we're going to change the health of the population. The strength of the Collaborative School of Public Health is in the ability to bring these disciplines together to address the most important public health problems of our time.
And finally, it's expected that the collaborative school will enhance our opportunities to train a public health workforce that we need so badly in our state. This is a chance for them to work in multiple settings and in both the in practice and also in research. It's reasonable to expect that the increased visibility of the collaborative school will result in an increased enrollment at a time when we need more public health workers. The quality of that education can do nothing but get better. So thank you very much.
Good job. Jane and Jay, thank you so much for your critical role in making today possible. And Jane, your closing comments are a wonderful segue into our next two speakers. We are very pleased by the fact that today's announcement and your comments, Jay and Jane, highlight the fact that this collaborative school will address one of the most significant workforce issues in our state and nation, and one that state officials and the Board of Regents have asked us to address, this crisis really nationwide in this shortage of public health workers. I'd like now to call to the podium two of our nation's most distinguished public health officials who can explain why we urgently need more public health graduates. First, we have Dr. George Benjamin, Executive Director of the American Public Health Association, and he will be followed by our very own Dr. Josh Sharfstein, Maryland's Secretary of Health and Mental Hygiene. Dr. Benjamin?
Well, good morning. You know, I get to be here this morning kind of wearing three hats. One, of course, having been a former health secretary for the state of Maryland. Secondly, having the honor of being on the University of Maryland Medical System Board. And third, having a national role at the American Public Health Association, I might add, which was the founder of the accreditation school body several years ago. We've now spun that off, so no conflict of interest here, but we've been in this issue of being concerned about education for a long time, and I just got to say that a dynamic world requires dynamic partnerships. So this new partnership addresses several needs. Number one, we have a graying workforce. We have about 500,000 public health workers, and about half of those workers will be eligible for retirement very soon. And that's in addition to the thousands of researchers that we wrap around those practitioners of public health. Secondly, we need new skills. As you can understand, we have a rapidly remodeling health system that we need to address, and a number of emerging new health threats and the return with a vengeance of old health threats. I mean, think about what we've had in the last 20 years: West Nile virus, anthrax, a range of resurgence of new diseases, measles, pertussis, et cetera. So we have a lot of things that we need to address, including a chronic disease epidemic we need to get our hands around. And then finally, we're in a global world. And a global world requires new skills, the ability to work across a range of new disciplines, to range with people, work with people we hadn't even thought about. Think about the importance of building our communities so they're healthier, so that we think about what happens when we build a transportation system that can really not only get us from point A to point B, but also can do so in a way that improves our health. So new skills for a dynamic world right here at the University of Maryland. I thank you.
Good morning, and thank you for having me as part of this exciting announcement today. I'm Josh Sharfstein, the Secretary of the Health Department. I really appreciate the chance to represent the O'Malley Brown administration in supporting what is being announced today. I want to especially thank the Senate President and Chairman Hubbard for your personal leadership and the General Assembly's terrific leadership when it comes to health. It's really allowed Maryland to make some incredible strides and be poised for even bigger strides. I couldn't have said it better than George's Benjamin, that the public health workforce is in a serious condition, and the challenges of a modern world require a lot of attention to the workforce. I think he explained why very well. To me, what it boils down to, particularly in what I'm dealing with and the state's dealing with, is how does that translate into actually helping the state solve some of the challenges that we're facing. And one of the things that we've seen is tremendous work both at the University of Maryland at Baltimore and in College Park coming together to help us solve some of the serious challenges that are facing the state right now. And I just want to give a couple examples, and I think from my perspective as the Health Secretary, what this partnership really means is the ability to continue to make progress in these and other areas. And I certainly appreciate the fact that there is tremendous dedication at the senior levels. Chancellor Kirwan has always been available, and I know has a special interest in public health issues like college drinking. Dr. Perman and I have worked together on a whole bunch of different issues, and Chancellor Lowe is obviously doing a terrific job in College Park. But even underneath the leadership, there has been tremendous work to come together against some of the challenges in Maryland. I'm just going to give 3 specific examples, one of which relates to health disparities, which are a major challenge in our state. And when we realized that we weren't making the kind of progress that we need, both racial and ethnic health disparities and geographic health disparities, like serious challenges that we have on the Eastern Shore, we picked up the phone and called Dean Reese. Dean Reese stepped forward and pulled together a group that included Dr. Thomas from College Park and others to put together a plan for the states that's really been a roadmap that the General Assembly then implemented a big part of last year in some historic legislation. And it was that collaboration that has really set the stage for progress on a really critical issue. Chronic disease is a major challenge. It is the leading cause of death. It is a leading cause of healthcare costs. And when we needed a partner for public health to support efforts on chronic disease around the state, we turned to Dr. Perman. He is established the Institute for Healthiest Maryland that had its board meeting that is involving College Park and other campuses to really bring the tools of the academic world in Maryland against some of the challenges right at the local level. And the third relates to Prince George's County, which has had a very challenging healthcare system for a number of years, trying to figure out how to move that system forward, both in terms of a new hospital center and in terms of a new healthcare system. It's been an incredible partnership between the University of Maryland medical systems, with the medical school participating on the one hand, and College Park School of Public Health with Dr. Kleinman and her team here, which did an amazing analysis to show what could be gained by a new medical and healthcare system in the county. And it really, all those examples and others give you a sense of the kind of change and improvement in Maryland's health that is possible when we can harness the incredible human and intellectual resources against the problems that we face. So I may be the most excited person here today. Okay, that's what I'm trying to get across. And I really appreciate all the work that has been done to this point, and I will be calling. Thank you.
Dr. Benjamin and Dr. Sharfstein, thank you so much for those comments. We are deeply honored by your presence at this event today. I think as several of the speakers have noted, as proud as we all are of this new school, it will, of course, be the students who will benefit most from its creation. And we're pleased to be joined today by two of our current students to offer their perspectives on this occasion. The first is Amanda Strouser from the University of Maryland School of Public Health in College Park, and then Jamalath Torain from the University of Maryland School of Medicine in Baltimore.
Hi, I'm Amanda Strouser from the University of Maryland School of Public Health in College Park. And Amanda, and it's S-T-R-A-U-S-S-E-R.
And my name is Jamila Terrain. I'm from the University of Maryland School of Medicine in Baltimore. And what we both have in common today is that we're both students working on our Masters of Public Health.
I became interested in public health after an undergraduate study abroad trip to South Africa, where I worked with children who are HIV positive. I'm very excited about a career in public health and by the opportunities that this collaborative school will provide. Collaboration on many levels is important in understanding and solving public health problems like HIV/AIDS. We need to look at it from a clinical perspective and understand what it means to have the disease and the best treatments available, but it's also crucial that we understand people's behaviors and why they engage in high-risk behaviors in the first place, or why they may not adhere to a treatment regimen.
I too became interested in public health as an undergraduate student. I actually attended the University of Maryland College Park as an undergraduate student, and I obtained my bachelor's in community health in 2010. My interests were injury prevention, and now they more recently have changed to injury prevention and control and gerontology. As a student from both institutions, it's always been a dream of mine for there to be some type of collaboration between the two schools. So I'm very excited for this. I look forward to working with the behavioral health experts of the University of Maryland College Park, as they are known for their community-based research and translating that research into clinical practice.
I imagine that having access to the School of Medicine's expertise in clinical research and their global health will be a wonderful complement to my training in College Park.
In short, we both were looking forward to the collaboration and the many opportunities that they may provide. We hope that these opportunities will prepare us and our fellow students to effectively address public health concerns of this country, the state, and this world. Thank you so much for having us here.
Thank you so much, Amanda and Jamalath. I must say that listening to these two exceptional students speak make me very proud of the University System of Maryland and these two campuses, and also I think you couldn't ask for better representative of the next generation of public health leaders. So thank you so much for being part of our program. Well, this concludes the formal presentations for our announcement, but members of the platform party have agreed to stay around for a bit, so if members of the audience have questions they'd like to ask, please come forward and do so. And let me just conclude by thanking all of you for being here today on what is, we think, a wonderful, great day for the University System of Maryland and empowering the state. Thank you.